Okay, Rami, it's a question. The questions will be at the end of the presentation, right?
Yes, the question will be, if you would like to open the questions in the middle of the presentation, I mean to be an interactive session, we can do that. What's comfortable for you?
Whatever is okay with you. If you need a translator or anything, I think it will be better at the end then.
Yeah, okay, let's keep it at the end. Okay, let's just start right now. I'll introduce you in Arabic and in English. السلام عليكم ورحمة الله يعطيكم العافية جميعا مرة ثانية. بنرحب فيكم معنا بالمحاضرة الأخيرة لمؤتمرنا الثاني لجودة الهواء والبيئة الصحية الداخلية، وراح يكون معنا خوسيه إسبينو من بنما، هو رئيس جمعية جودة الهواء الأمريكية فرع بنما، وهو شخص متخصص بالسيفتي والاوكيبيشنال هيلث، وكمان سيرتيفايد في بلده في مواضيع ال HBSE related topics. Mr. Jose, we are really glad to have you here. Please welcome Mr. Jose Espino, our last, let's say, speaker today, last but not least. His topic will be about ventilation for preventing COVID-19 in non-healthcare facilities. Mr. Jose is the director of the Indoor Air Quality Panama chapter, our, let's say, brother chapter. And he is a very, let's say, well experienced, and he's a certified occupational safety and health in Panama, in his country. Mr. Jose, I'd like you to introduce yourself more and start your presentation. Thank you very much for being with us.
Okay, thank you, Rami, and good afternoon, I guess, right? Here's the morning, but I guess in Jordan is afternoon, the night. So
Yes.
Good evening to everybody, and thank you very much for inviting me to your conference. I hope to provide important information for all of you. Okay, so let's begin. Just to go into context. Oh, I'm sorry here. I'm sorry, let me get this out of the way. Okay, just to go into context, we're going to be talking about the virus, the coronavirus SARS-CoV-2. That means severe acute respiratory syndrome, coronavirus number 2. That causes the disease COVID-19 that you are all aware of, okay? This virus has important characteristics, and one of the most important ones that we're going to be addressing here is the aerodynamic diameter of the virus, which is approximately 0.12 micrometers, okay? So we're going to remember this number here. This number is going to be important when we're going to be talking about filtration. This is a relatively big virus compared to others that are very small. So we're talking about a particle that has approximately this diameter. If we compare it to other sizes of particles, we have it right here on my left. Okay, 0.1 approximately. This is a PM10, for example, or a PM2.5. So we're talking about filtration of a relatively small particle, which is good news. Okay, it's good. Remember that when we're talking about filtration, the hardest size is around 0.5, okay? What are the transmission modes of SARS-CoV-2? The main one is close distance, okay, propagation of small droplets. We also know that the virus is transmitted through fomites, which are contaminated surfaces. Okay, people that are sick can deposit particles on surfaces, and healthy people can then touch the surfaces and touch their eyes, their nose, their mouth, and get and contract the disease. But the third one, which is the one that we're going to be talking about, is the airborne transmission of droplets. Okay, this is one that has been going around for some time now. People don't seem to can transmit the disease, but we have enough information, scientific information, that tells us that yes, this is a way that we need to. This is a transmission mode that we need to be aware of. Okay, ASHRAE has published several position documents on infectious aerosols this year. This is the main one that was approved in last April 2020. And there's been other documents as well on the position of ASHRAE in regards to if the disease can be transmitted through the air conditioning or the HVAC systems. These are the statements. I'm going to go over them very quickly. ASHRAE statement on airborne transmission of SARS-CoV-2. ASHRAE states that the transmission of SARS-CoV-2 through the air is sufficiently likely that airborne exposure to the virus should be controlled. Changes to building operations, including the operation of heating, ventilation, and air conditioning system, can reduce airborne exposures. They also have another statement stating that ventilation and filtration provided by heating, ventilation, and air conditioning system can reduce the airborne concentrations of SARS-CoV-2 and thus the risk of transmission through the air. Okay? So here we have two things. First, that yes, the virus can be transmitted. It is highly probable that the virus can be transmitted through the air, and that the ventilation and filtration can reduce the airborne concentration of SARS-CoV-2. Okay, this is ASHRAE's position on this issue. Apart from that, there's a very interesting document that you can see here on the screen. It's called "It's Time to Address Airborne Transmission of Coronavirus Disease 2019. This document was written by a series of very highly renowned scientists. These are their names here. And they're trying to tell the World Health Organization that it's time to address this way of transmission. This document was also revised by more than 100 other scientists, and they all agree that this needs to be addressed. Okay, so this is why we think it's very important that we as engineer or industrial hygienists address the transmission, the air transmission mode of the virus. Now, what is the position of the World Health Organization? The World Health Organization states that aerosol transmission can occur in specific settings, okay? I mark it here in red, particularly in indoor, crowded, and inadequately ventilated spaces where infected persons spend long periods of time with others, such as restaurants, short practices, fitness classes, etc. Okay? They also say that more studies are underway to better understand the conditions in which aerosol transmission is occurring outside of medical facilities. Again, here in this presentation, we're talking about non-medical facilities. So basically what the WHO is saying is that it can occur in certain conditions, okay? And this agrees partially with what the CDC has to say. Okay, this is the latest statement from the CDC on airborne transmission of SARS-CoV-2. And they say that pathogens are mainly transmitted through close contact, but sometimes can also be spread to airborne transmission under special circumstances, okay? So we see that the CDC is more or less aligned with the World Health Organization on that. So basically, everybody's saying that, yes, there is a possibility of airborne transmission of SARS-CoV-2, and we need to be aware of that and take the necessary precautions. Okay, this is a model generated by the Journal of American Medical Association. I think it's interesting to see how these droplets are transmitted through the air. Okay, so let's see the model. This is the emission of droplets from a person coughing. You see the big amount of droplets that are being produced, and pay close attention to the distance down here, okay? This is 50 centimeters. So there's a high concentration of airborne droplets that are highly contagious because this person is sick. And now we're gonna go a little bit further. This is 110 centimeters. It's a 1.1 meter. Okay, now you can see the cone of transmission. The high concentration is close to the person, but there's a lot of droplets that will migrate further than the person. Still, there's a high concentration of viruses, of droplets in this area. We're going to go even further. This is 7 to 8 meters. You see that this is a sneeze. The person can expel a big amount of droplets a great distance from where he or she is standing. So what happens, let me go back a little. What happens with all these droplets here that are eventually going to be dehydrated, are going to be dried, and we're going to have a considerable amount of possibly infectious particles that are going to be floating around in the environment. Okay, the idea is that a person that is infected and is exhaling, and we're talking about an average of approximately 77 particles, infectious particles per minute. That's more or less the average. And if you don't have a good ventilation of the area, the concentration of these particles inside the indoor space will increase as the time passes. Let's see it here. The person is exhaling. This air is just recirculating, and more particles are being exhaled, and the concentration of viral infectious particles will increase as the time goes by. Okay, let me pause this here. Now, if you have a healthy person inside this area here, and let's assume that this person is asymptomatic, okay? So she doesn't have any symptoms. She's just exhaling, talking, I don't know, whatever. Another person inside this space, after a certain amount of time, can reach the dose, the minimum dose necessary to be infected by the SARS-CoV-2 and get COVID-19, okay? So our main concern here is to dilute the amount of particles inside this space, okay, or in a certain way, get these particles out of the way. You know, we don't want other people to be inhaling these infectious particles from an infected person. There are several case studies that have been documented. This is the Guangzhou restaurant in China, where this was one of the first studies that was documented. We have the infected person here, okay, and these people remain in this restaurant for about 2 hours, and this person infected not only the people on his table, but also people that were a certain distance from him. Okay, we got 3 infected on this table here, and several others on this table. And the air conditioning system, the flow was moving in this direction. Okay, so it is believed that yes, the flow and the air conditioning system had influence on the propagation of the disease in this restaurant. There are other cases as well. We have a call center in South Korea where 1,143 persons worked in 11 floors, 97 persons infected, okay, 43.5% infections in floor 11 where the case was. Okay, there were interactions between different workers in the different floors, so many others were infected in other floors as well. Okay. There's another case, church course practice in Mount Vermont in the USA, 61 participants, 2.5-hour practice with social distancing, hand hygiene, and respiratory etiquette, 53 infected, 2 deaths, okay? 87% of the group developed COVID-19. We know that singing increases the amount of particles that a person that is sick will exhale significantly. And there are many other cases, okay? These are ones that I just wanted to bring forward so you can see that, yes, there's some background the probability of infection through the HVAC system. Now, what are the key factors? First of all, you need a dose, okay? So this will depend on the exposure time, the amount of sick people in the building, and this you sometimes don't know. In Panama, we have been following up on the tests on asymptomatic persons. We have a big banking center in Panama, and the government is requiring a certain amount of tests for asymptomatic people, and it's consistent with other statistics. We're talking about 3%, okay? So you might want to consider that number. If you have 100 people in a floor, in a building, and they're all asymptomatic, if you test them all, you're gonna get approximately, and there's no scientific evidence on it, this is just statistics that we're keeping up with, but you're gonna find around 3 persons that are gonna test positive for COVID-19, okay? In 100. If you have 50, it's about 1 to 2, and so on. Okay, another key factor is that you have to consider if you have social distancing between 1.5 to 2 meters. Do you have it? How close are the people working inside the building? Study, and there's the reference here, says that you are most susceptible, or you have more probability of infections inside building than the interiors, okay? 18.7 times more. You also have to consider the air movement in the building. Okay, how is the air moving? From clean to dirty, from dirty to clean? How is the airflow in regards to people that are possibly sick? How much ventilation do you have? And this we're gonna cover in just a second here. And what could be the influence of the HVAC system? So let's start with the definition of ventilation. According to ASHRAE, ventilation is defined as a process of supplying outdoor air, okay, to or removing indoor air from a dwelling by natural or mechanical means. Okay, so very important here. We are talking about how much air from the outside we are introducing into the building, okay? How much outdoor air. We know that according to regulations, I'm not familiar with the regulations in Jordan, but in most of the countries, and I'm sure your country as well, there are some requirements that we need to comply with as engineers when we design an HVAC system, okay? We need to have a certain amount of outdoor air coming into the building, okay? ASHRAE 62.1 and 62.2 will give you some minimums that you can consider, or you can go along with the local regulations if you have them. And again, this will also depend on the climate. In my country, we are in the tropics. We have a very hot and humid climate outside. We're talking about 35, 36 degrees Celsius with maybe 80% humidity. I know in Jordan, the temperature can go up in the summer, but you have an advantage. You have a very dry climate. Okay, so, well, depending on how high is the temperature and the humidity, then you will be tied to how much outdoor air you can coming into the building. Okay, you don't want to get all this humid hot air into the building because maybe the system will not be able to compensate for it. So this is something that you need to consider, okay? It's very easy to say, well, you know, you can have 100% outdoor air, but if you have 36 degrees out there with 80% humidity, that is not feasible. Okay, so these are the recommendations from ASHRAE. Their summary: increase outdoor air ventilation. Okay, disable demand control ventilation, open outdoor air to 100%. Again, 100% if you can, okay, if it's feasible, if outdoor conditions permit. In our country, this is not possible. We cannot open dampers to 100% because outdoor conditions will not permit it. Okay? Improve central air and other HVAC filtration to MERV 13. Minimum, we're going to talk about the filters in just a minute. Okay? Minimum efficiency reporting value, this is what MERV means, or the highest level achievable. Keep systems running longer, maybe 24/7 if possible. This will increase your electricity bill considerably. Add portable air cleaners with HEPA or high MERV systems with due consideration to clean air delivery rate. Act duct or air handling unit mounted upper room or portable UV germicidal irradiation devices in connection with room fans in high density areas. Maintain temperature and humidity as applicable, and bypass energy recovery ventilation systems that leak potentially contaminated exhaust air back into the outdoor air supply. Okay, so these are the ASHRAE recommendations for buildings, not healthcare buildings. The World Health Organization, and they also have some recommendations that are basically the same. Okay, so I'm not going to read all of them. Okay, so what are our options to decrease the probability of COVID-19 inside our buildings in regards to the HVAC system? First of all, and the most important one, is ventilation. Okay, you need to have a minimum ventilation. That means air, outside air coming into the building. Okay, you can check ASHRAE 62.1 or your local regulations, but zero ventilation, in our opinion, is not an option. Okay, you need to have something. If you go to ASHRAE 62.1 and you make the math, you're gonna have, depending on the dwelling, you can have between 1 to 2 air changes per hour. Okay, they use liters per second per person, and then they have another formula for an X amount of air for every square meter. But at the end, you're gonna have around 1 to 2 air changes per hour. And that's the unit that we're gonna be using in this presentation, okay? Now, on top of ventilation, again, on top of that, okay, not replacing, but complementing ventilation, then you can have filtration, and the filtration will be divided between the filters in the HVAC system and the portable room air cleaners with HEPA or high MERV filters. Okay. First, you're going to see how much you can increase the filters in your HVAC system. ASHRAE states that a minimum of MERV 13. Okay, but that will depend on your system. Your system might not be able to accept this high filtration systems because of the way the system was designed. If you have a direct expansion system, you might not be able to go to MERV 13. Maybe with a water cooling system you can. So this needs to be checked by an engineer. Okay, what is the increase in pressure in your system? Okay, so this has to be checked. Now, the other option you have is UV radiation, ozone, or electrochemical oxidation, for example. But again, let's put it in this order. First, you need ventilation. If you cannot get the amount of ventilation that you need, then you can add filtration. And if you don't get the amount of ventilation you need, adding ventilation plus filtration, then you can go into other options. Now, anything that is not ventilation per se, for example, filtration and air purification, is what we're going to be calling equivalent ventilation. So what we have to do is we have to estimate how much ventilation we're going to get from filtration and how much ventilation we're going to get from air purification. So when we add ventilation plus filtration plus purification, then we're going to get the air changes per hour that we're aiming for. How much do we need? Well, this is a table from the CDC, and we're usually aiming for 6 air changes per hour, okay? ACH, air changes per hour. Because if we get 6 air changes per hour, we're going to get between 99 to 99 point something efficiency, filtration efficiency in 1 hour, okay? Between 46 minutes and 69 minutes. So we're talking in this area here. 6 air changes per hour, we should be getting close to 100% filtration. We're using the shot from Harvard T.H. Chan School of Public Health. I think this is a very good chart here that you can use. This was generated for schools, but they apply to buildings as well. Okay, according to this scale here, we're talking about the ideal being 6 air changes per hour. Between 5 and 6 is considered excellent. Between 4 to 5, good. Bare minimum, 3 to 4. And low, less than 3. Okay, so what we're doing with our clients in our countries down here is that we are suggesting at least 5. Okay, at least 5 air changes per hour, preferably 6 or more. But again, we have a high thermal load out there. Okay, we have high temperatures, high humidity. So we cannot go to 12 or 10 or 20 air changes per hour because you're going to need to change the whole HVAC system. Okay, so we're aiming for 6. You also have to consider that you have to maintain thermal comfort inside the building. Okay, this is the graph from ASHRAE 55. Here we work around this area here, which is between 22 degrees C to around 26 degrees Celsius with a 0.5 clove. Okay, this is summer clothes. So we're trying to maintain the temperature and relative humidity within this area here. Okay, and this has to do also with the relative humidity control for COVID-19. According to this study, this is the best range between 40 to 60%. Here you can see a U-shaped curve. This is 20 degrees Celsius. Okay, after 1 day, for example, you're going to see that the inactivation reduction will be less in this area here. Okay, so you want to keep the relative humidity around 40 to 60%. The problem we have in our country is that if you're working in this area over here, then we're going to have fungal growth. So we have to be careful with that. We usually try to maintain everything below 60%, but we don't want to be so dry because working in this area here can dry your upper airways and will make you more susceptible to contracting the disease, according to some studies. Okay, so you can use data loggers, temperature, relative humidity, and CO2 loggers to control this. Okay, CO2 you can use to control the ventilation, as we're going to see a little further. The other thing that you need to consider is the bathrooms. Okay, ventilation in bathrooms should be operating throughout the whole working hours to make sure that aerosols from the toilets will not get pushed inside the buildings. Okay, it is known that the feces and urine from infected persons have a high load, a high viral load. Okay, and there's also been documented cases in China where there has been migration of infected aerosols to other floors. So we want to make sure that we keep the drain filled with water and that the exhaust is not being sucked into other areas of the building, okay? Because this can be dangerous. So we want to make sure that the exhaust systems are working continuously throughout the whole working day and that air is exhausted to areas away from the intakes of the HVAC system. Okay, now in regards to filtration, the recommendation from ASHRAE is that you use a minimum of MERV 13. Down here, okay? If you use the ISO 16890, that's the equivalent to a PM1, because this is the filters that can handle viruses. Particles in the range of 0.1 micrometers that we talked about at the beginning of the presentation. Okay, so this is the size that we want to be handling. Most of the systems, at least in our areas, are not designed to tolerate a MERV 13 or greater. Okay, this is usually the filters that we find. These filters are maybe a MERV 4 to a MERV 6. So they do not function against viruses. They are not designed to filter particles within that range. Okay, so this is something that you need to address. The big question here is, can your system tolerate a bigger or more efficient filtration, maintaining the flow? That is something that you need to answer. This low filtration system in the mini-split systems do not work. Okay, so this is just for a big diameter dust. And you also have to check the systems, because when you go into the air handling unit rooms, you can see that there's spaces between the filters, for example, or sometimes they're not even in place. Sometimes somebody cleaned them and they just left them on the floor. Okay, all of this has to be checked by either the engineer or the industrial hygienist. Okay, this is common also. So you get air bypassing through here. Okay, so this, what you're seeing the screen right now is the filtration efficiency curves for the different MERV ratings. Okay. Basically, what we're doing is that we are trying to filter particles around 0.1. Okay, so you can see the filtration efficiency on this axis over here. If you're talking about 14, you might be close to 80%. But if, for example, you're using a MERV 6, okay, for viruses, you are hardly making 10%. So what we're trying to do is to increase the efficiency of filtration, okay, so that we can filter the greatest amount of particles that are recirculated. Okay, not the ones, because again, we are complementing this with outdoor air, okay? So we are saying, okay, the air that is recirculating, we want to filter the greatest amount of particles that we can, maintaining the working conditions of our HVAC system. Okay, so that's where we're working. Let's see a case study. So you can get better understand this. Okay, this is a building number 1. And this is a 9-story building. We're just going to analyze level 100 or level 1. In this level, we have 2 air handling units, number 1 and number 2. And the capacity in tons of refrigeration is 25 for the air handling unit 1 and 15 for the air handling unit 2. Okay, so total we have 40 tons capacity in this level. Now, we have to go into the building and measure the actual CFM, not the nominal. Remember, this is design. This is what you're supposed to have. But as engineers, you know that this never happens. Okay, maybe this was when the building was new and if it was properly installed, etc. But we need to have the actual CFM in order to estimate how many air changes per hour we have in the building. Okay, so we go in with anemometers and we measure that. Okay, so how many CFM do we have? Instead of having 16,000, we have now 8,927, which is a little bit more than half. Again, we have to go in through the building and measure the amperage and the diameter of the see. Oh, I don't know how you say the where the belts go. I'm sorry, I don't. Sometimes I don't know the names in English, but the amount of RPMs in the motors, etc. Okay, so our engineers go in, they measure all that, and apart from that, we also have to have the actual CFM. Now, what do we do with this information? With this information, and knowing the area of the building, in this case, it's 767 square meters, which is the same as 8,252 square feet, and the volume, okay, and this is the CFM. Okay, so for this area, we have this amount of CFM. Okay, the next step that we need to do is measure the existing fresh air intake. How much ventilation is coming into the building. Remember, this is the total flow, but this does not include, this includes the ventilation. But we need to see what is the percentage of air from this 8,927 that comes from the outside. So we go in and measure, and we found out that it was non-existent, okay? It was zero air intake, and this is very common in the tropics, where again the temperature is very high and you have very high humidity, and dampers are closed, and people just forget about air intakes. They just close everything and don't worry about it. That way, the comfort parameters are good inside. People feel good inside the building. This is bad. This is bad for COVID. Okay, everybody was okay in the building in regards to temperature and humidity, but again, no air intake, just from what could get through the doors and maybe some cracks in the windows, etc. So how much do we need for 6 air changes per hour? 6,601 CFM. This is what we need, okay? In order to comply with the 6 air changes per hour that we want in order to prevent COVID-19. We have 0. Okay, so after our engineers did all the analysis in regards to the thermal load that the system can support, we decided that that system, it was a very old system, can only, we didn't want to go over 1 air change per hour, okay? 1,100, that's 1 air change per hour. We don't want to go over that because then you're going to mess up the whole psychometric conditions inside the building. So we are going to go with the bare minimum. We can open dampers and get 1,100 CFM inside the building, okay, from the outside. That means that we still need another 5 air changes per hour in order to be safe, okay, relatively safe in regards to COVID-19. If we open the dampers and we get this, then we're going to still get 7827 CFM of recirculated air. Remember, if we add this to what we can get by opening the dampers, plus what we're recirculating right now, this will add to the total CFM that is moving in the building, okay? So we checked the system, and it was determined that the maximum we can raise the filtration was a combination of a MERV 6 pre-filter with a MERV 12 backup filter. And at the end, we measured that and we could get around 45% more filtration efficiency, 45%. That means that the recirculated air passing through these filters that we redesigned will be filtered to a 45% efficiency, okay? So we're going, in theory, to be removing, be removing particles, and the air will be this number here, 3522 is the amount of air that is going to be clean, okay? Cleaned by by these filters, again, in theory. So if we add what we can get from ventilation, which is 1,100, plus what we can get from filtration, and this is called equivalent ventilation, so it's the addition of what we get from filtration plus what we get from the outside air, then we're getting 4,622 CFM. That is equivalent to 4 air exchanges per hour. Okay? Again, adding outside air plus we get what we can get from filtration. This was the maximum we could get because of the conditions of the system. We're still in 4. Our client says this is not enough. We want 6. Okay? This means that we cannot get more from outside air and we cannot get more from filtration because the system will not tolerate it. So then we have to go into purification system. Okay? And maybe design a system with UV light or something that could help us approach this 5 to 6 range. That is what we're trying to get here. Remember the scale from Arbor? So we are around here. Okay? So our third option after ventilation filtration is UVC radiation, and this needs to be designed. It's not just a matter of installing lights. So we run a software here, and we can get a combination of open room radiation with UV radiation inside the system. Okay, this is for the coil, but very important. This is what you need in order to purify air. Okay, radiation in the ducts, not in the coil, because air moves so fast through the coil that viruses will not be inactivated if you have the lights in a horizontal position. They have to be along the axis. So what we need to estimate, according to the velocity of the air inside the duct, is how much exposure time do we need in order to inactivate the viruses so that we can get the length of these bulbs here. Okay, and this is sometimes very hard because we don't have enough duct. For example, if we do our estimates and we decide that we need 2 meters here, maybe we don't have 2 meters of duct. So we are not getting the efficiency that we want. Okay, in this case we did. Okay, and we had a combination of germicidal radiation inside the ducts and upper room. So with that, we added another 2 air changes per hour, and we can get up to 6. Okay, and this is there's softwares that you can do this in order to determine the length of the lights that you need to install, and then you can decide where to install them. Again, these lights here are only to disinfect the coil, but if you need to purify the air, then you need additional lights inside the ducts. Okay, lastly, I still have a couple minutes here. I'm going to show you what we do with, once we have all this information, then we can run it through a model. We use the Fatima software. This is from NIST, and you can get it for free through the internet. Fatima means Fate and Transport of Indoor Microbiological Aerosols. Okay, so we can put all this information that I just mentioned into the model and determine what is the airborne concentration of this number sign here means the amount of, in theory, the amount of particles, infectious particles that you're going to get inside the building. So in this case, we have people coming in around 8 o'clock in the morning. The viral particle concentration increased significantly in about 1 hour, more or less. Then the HVAC system, HVAC system, is capable of maintaining the concentration, okay, in around maybe, I don't know, between 8 to 10 particles per cubic meter of air. That is very low, very, very low. That's good. And at the end of the working day, when people leave, then the HVAC system is capable of cleaning the air in around an hour and a half. Okay, so we want to make sure that the system operates for at least 2 hours after the people leave. Okay, because we're going to get this concentration down to 0. That's what we want. Next day, when people come back to work, we don't want to have any air particles, infectious particles in the air. Okay, so in theory, we want to get this down to 0. But again, these particles are also being deposited into different surfaces, and that needs to be considered. Okay, well, this is another graph. What is the particle fate? Okay, 49%, this is all given by the model, exited the zone. This was deactivated. Small percentage was filtered. Remember, we're not getting very much efficiency here. But what we want is to know where the particles are deposited. And according to our model, 94.6% of these particles are on the floors. Okay, you can have a small percentage on the walls. So we want to make sure that you get your cleaning and disinfection crew coming in at night, not during the working day, okay? We want to get all these people cleaning this office, for example, around this time here, when everybody leaves, and what we have is basically particles on the surfaces. Okay, so it's not a good idea to be cleaning during working hours, because you're going to be generating more particles, and these particles are going to be depositing on the floors. So our suggestion is that you do that after hours. Okay, so here we have a combination of ventilation, minimum ventilation that we can get, increase in the filtration efficiency, plus UV lights to get around 6 air changes per hour, plus a good cleaning and disinfection protocol after hours. And in that way, we believe that the possibility of contracting COVID-19 will be minimized. Okay, so I thank you, and I'm open for questions.